Good afternoon. Thank you for joining us for another installment of COVID-19, the Path Forward series hosted by Weber Shandwick. I'm Jack Leslie, and I'll be the host and moderator for today's webinar, which is the third in a series designed to help you and your organization navigate the challenges of the pandemic and the vaccination rollout. As many of you know, Weber Shandwick is a leading global communications and engagement firm with offices in 78 cities and a network extending to 129 cities around the world. And as our clients continue to face the unprecedented business and communications challenges brought by the COVID-19 pandemic, Weber Shandwick's COVID-19 task force offers support and counsel on communicating through the crisis. Earlier this month, we launched Plan Vax, a custom offering that draws on our extensive vaccination and public health communications experience. And as part of that offering, we made a playbook publicly available that provides best practices and resources to organizations of any size. And you can find that playbook by looking on webershandwick.com. And of course, that's why we're here today, to share insights and to ask thought-provoking questions that are going to help us determine how best to respond to this ever-changing pandemic landscape. So to get started, I'd like to introduce our two expert speakers who both have a rich background in communications and who've been at the forefront of the COVID-19 response. Aaron Streeter is the Senior Vice President of Communications and Brand Strategy at the National Association of Manufacturers, an organization whose members include those involved in the manufacturing of COVID-19 vaccines, and that launched the This Is Our Shot project, which she'll talk about, to provide resources for manufacturers across all sectors. We're also joined by Stephen Massey, the co-founder of Meteorite and the director of the Health Action Alliance, which is a joint initiative of the Ad Council, Business Roundtable, CDC Foundation, Dumont Foundation, and the Robert Woods Johnson Foundation. Stephen's a social entrepreneur and communication expert who builds unlikely partnerships for good across geographies, industries, and sectors. And before we get started, I just want to remind all of you that we're going to try to leave about 15 minutes at the end of our session for questions. So if you have any questions, feel free to submit them on the questions feature that you see here today, and we'll talk to our speakers about them. So welcome, Aaron and Stephen. Thanks so much for coming here today. I thought maybe we'd start at kind of 30,000 feet and look at sort of where we are, certainly with the state of the vaccine rollout. You know, just last week, President Biden increased the administration's vaccine goal to 200 million within the first 100 days. And the administration's directed states to make every adult in the US eligible for vaccination no later than May 1st. Stephen, maybe if you could help us set the stage a little bit. You have some slides. I was telling everyone earlier how much I hate PowerPoint, but these slides are great slides. So well, if you could talk a little bit about, I mean, because so much of the discussion now, you know, we started this thing, everyone being frustrated at not being able to get vaccinated. And now we're moving into this, all of the talk about vaccine hesitancy. So talk to us about that and what some of the research is showing about how attitudes are changing.
Well, first of all, thank you so much, Jack. It's great to be here, and it's an honor to be invited. Aaron, it's terrific to see you again, and delighted to be sharing this webinar with you. Jack, to answer your question, the state of vaccinations is good. We are seeing an increasing number of Americans getting vaccinated. Nearly 1 in 3 Americans has received at least one vaccine dose, and 16% of Americans have been fully vaccinated, according to the latest CDC numbers. The pace of vaccinations has also picked up. Nearly 3 million shots are being given every day. And just to consider for a second what that actually means, it's equivalent to vaccinating the entire population of a state like Nevada or Iowa or Connecticut every single day. That's truly remarkable. And to put it in context, about 100 million Americans have been vaccinated so far. And that's roughly the same size as the entire television audience for the Super Bowl, which is, of course, the most watched TV event of the year. So a lot of Americans have been vaccinated. That's really good news.
Yeah.
But science suggests that it's going to take 3 out of 4 Americans to be vaccinated to reach community immunity. So we do have a long ways to go. And that's going to require trust building and transparency and accountability, and the business sector really getting engaged to build vaccine programs and policies that will support workers. There's more good news about vaccine confidence, and we're seeing it shift really quickly to more confidence. 55% of Americans have already received or intend to get vaccinated, and just 22% are now resistant but open. 2 in 10 Americans are, I would say, in the no column. And this really is a dramatic shift from where we were even just a few months ago, when a majority of Americans were skeptical. So if we assume that community immunity can be achieved when 3 out of 4 Americans gets vaccinated, really we're in good shape. And the quickest way to get there is to build confidence within that group that's currently in the maybe category. We like to think about this group as the movable middle. So we want to move them to the right. And then for those that intend to get vaccinated, we want to help them make sure that they can fulfill on that intention by making it as easy as possible for them to get vaccinated when it's their turn. There's been a lot of conversation about vaccine hesitancy, particularly in certain communities of color and other disproportionately impacted populations. The good news here is that is shifting, and it's shifting rapidly. Now, a majority of white Americans, Black Americans, and Hispanic Americans do intend to get vaccinated. But these numbers hide that there are actually stark disparities in access, which remain a serious concern. According to this poll, which was conducted just in the middle of March, 26% of white Americans who were polled say that they've already been vaccinated, compared to just 17% of Black Americans and 11% of Hispanics. And when you dig into the numbers by state, you can see some really stark gaps in vaccination by race. In California, for example, 21% of vaccinations have gone to Hispanics, while Hispanics account for more than half of cases, nearly half of deaths, and 40% of the total state population. In Washington, D.C., Blacks have received 31% of vaccinations, while they make up nearly 50% of cases, 75% of deaths, and 46% of the population. And in Georgia, Black Americans have received just 22% of vaccinations, whereas they make up about a third of cases, third of deaths, and third of the total population. So we really do need to do a better job in reaching communities most at risk. What we are seeing is that vaccine hesitancy is directly linked to partisanship, with Republicans reporting more vaccine skepticism than Democrats and independents. And this is especially true in rural communities and among Republican men who voted for Donald Trump. There's some good news here. 72% of Americans trust their employer more than any other institution. And so we believe that employers can play a really critical role in delivering trusted vaccine information to employees and boosting confidence. And we also know that 73% of Americans want to work for a company that protects its employees during the pandemic. And for those in the movable middle, those who are still undecided, we know that employers can help motivate cautious employees through convenience and modest incentives. For those who are undecided, 37% of them would say that they're more likely to get vaccinated if their employer arranges for an on-site vaccination, and 30% are more likely to get vaccinated if their employer were to offer a modest $50 incentive.
Well, I want to talk later more about the disparities issue and what we can do about it, because it's something that worries, all of us. And on the herd immunity front, I think the other good news is if that 55% does in fact get vaccinated, what's not on there is that perhaps upwards of 20% of the population has already been infected. And we don't know how long that immunity lasts, but hopefully it, for many of them, still is in existence. But maybe off that last slide, Aaron, you can, because this issue of incentives that employers can provide, and all the research that's showing, and this wasn't the case, as little as 5 years ago, that there's so much more trust now in your employer than there is just about in any other institution. NAM is, as I was saying in your intro, is a unique organization in that you cross so many different industries. And so you're not only, as I mentioned, representing companies that are manufacturing vaccines, but all of the rest of companies that are in the manufacturing business and of many different sizes. So talk to us a little bit, share with us what you're seeing companies of different sizes do to kind of address that last point Stephen was making about how companies can really play a major role in encouraging vaccination.
Yeah, I'd love to. And I want to thank you for asking me to be a part of this today. We think it's so important to get the word out. And I think what is really reassuring, Stephen mentioned this. I mean, we are coming together with so many different people. Stephen and I's paths have crossed through our work together. Really teaming up with a lot of different people that we have not intersected with before, to really kind of work together on this issue. And I think that is so, so vitally important. Just before I get into the incentive piece, Jack, I'd like to quickly give a little bit of context about the industry, what the industry was doing even before we got to the vaccines. You mentioned it. We have over 12,000 members, and we have more than 12 million Americans who make things in America. And that ranges from, in the vaccine supply chain, everyone from the researchers to those who are doing the final mile delivery of this vaccine. And so we touch a lot of different pieces of this, but also we have lots of manufacturers who've been essential workers from the very beginning of this pandemic. And so for us as an association, this journey started really from the get-go. We did run a pretty aggressive mask campaign when that was really vitally important, because we needed to make sure our workers could stay open, our economy could stay open, so they could be safe. And now that we're in the vaccine side of this, the vaccine hesitancy piece has become even more vitally important, to ensure that we can get back to normal. Interestingly enough, we had a webinar yesterday with our members, and incentives was a big piece of the discussion. And I think there's a couple of conversations that I think will be really valuable to everyone who is listening here today. One of the current trends we're seeing among our members is that they really are focused on incentives that are broadly available to everyone, that doesn't offer competition, that doesn't up one person or against someone else. They're really trying to make this broadly available to everyone and make it as positive as possible. So some examples of that, I mean, gimmicks are kind of, the gift card incentive. That is something that they are really kind of shying away from. And what we heard yesterday was a lot of time off, sick leave, paid leave. Also, they're doing things like, creating bulletin boards in the employee facility and having people post pictures of themselves getting the vaccine. They're doing company-wide celebrations when they hit 100% vaccination within the organization. They're utilizing a lot of different things to kind of put positive messages out to their employees, to talk about why this is so crucial. They're also making available through their communications channels, medical experts to talk about and ask employee questions. A lot of our manufacturers have clinics on site. And so they're making, again, the medical folks who are there available to the employees to talk about the things that they have questions about, to understand, many of the things that are of interest to them. So, I think it's an interesting conversation, and what we're really seeing is traditional communications channels are becoming vitally important for the manufacturing sector. We have a hybrid of different workers. We have a lot that have to be in the facility and on the line to those in office spaces. And so the communication channel are, the traditional ones, the mailers, the posters, all of those things are coming back because there's a lot of those folks who are not on the digital lines every single day to see those messages. And so it's been interesting to see some of those traditional communications channels come back to play.
Yeah, and I would think, especially in manufacturing, there's such a tradition of health and safety messages. I mean, you see them every time you go into a plant, how many days it's been since the last accident and so forth. There's a constant, drumbeat in so many companies. So in many respects, I would imagine that some of those traditional channels could really be helpful in this case. Stephen, I mentioned in your intro that you've got this Health Action Alliance that's been created. And maybe if you could just follow Aaron, gave some specific examples. I know you've got a guide that's meant to help companies, as they roll out their response. Talk to us a little bit about how companies can actually establish the plan, and some of the kind of key questions that they need to ask when they
Sure.
go.
Well, yeah, well, certainly. The Health Action Alliance was created, as you mentioned before, as a joint initiative of the Ad Council, the Business Roundtable, the CDC Foundation, the de Beaumont Foundation, and the Robert Wood Johnson Foundation. And the goal here was to really create a set of free resources, training, events, and support services to help companies of all sizes really lean in and support and accelerate the vaccine rollout, advance health equity, and begin to rebuild our public health system. We are at our core a resource hub, providing democratizing resources for the business sector. And we have resources for large companies, for small companies, helping them engage in this moment and make it as easy as possible for their employees to get vaccinated. I think as companies begin to consider ways that they can develop COVID-19 vaccine policies and plan, it's really important to start with a leader for that effort, a coordinator or a task force to craft that strategy, and to be someone who's responsible for really thinking about the various parts of your enterprise that need to be engaged in developing the program, like your HR or labor leaders, your employee resource groups, your legal department, et cetera. It's also super important to be familiar with your state's vaccination plans. Vaccines are being distributed by state health departments. And so every state is managing this process a little bit differently. And so for employers that work across several states, this can be challenging, but that's really the place to start. Guidelines are set by the federal government, but states make the final decisions about how vaccines are rolling out. We also encourage every employer to really proactively engage employees, including those from communities of color and other disproportionately impacted populations, to really listen to their unique questions and concerns before developing the plan. And then once you start crafting your strategy, there are sort of 5 questions that we encourage every company to ask themselves. The first really is, how can your organization remove every possible barrier to employee vaccination and make it as easy as possible for employees to get vaccinated when it's their turn? And so, we are seeing lots of employers, large employers and small employers alike, offering paid time off, sort of 4 to 6 hours of PTO for vaccine appointments, but also, offering transportation credits, daycare, meal vouchers, offering internet support services or language support for employees to schedule vaccine appointments at work, or even offering staff members who can help employees schedule those appointments. We've also seen companies offer PTO for employees that might experience any side effects, and other strategies in that regard. The second question that companies can ask themselves is, should my company incentivize employees to get vaccinated? And this is, a lot of what Aaron just mentioned. These kind of gift cards or vouchers or tokens or whatnot, celebrations that companies can offer. I would say that we're hearing from companies that they're shying away from some of these larger incentives. Early in the vaccine rollout, we saw sort of several $100s. I think one company that we've been working with was considering a $500 incentive, and these
And
offerings
you get a Krispy Kreme donut if you
well,
want.
and that's you're seeing more of that too. I think that the large incentives, while they might be well-intentioned, they might be seen as coercive as well. And for a vaccine that's meant to protect you and is safe and effective, you shouldn't have to incentivize with such a large amount. So companies might want to weigh that consideration as well. Another question that companies are asking themselves is, can we offer vaccines on site? The data suggests that on-site vaccinations make it a lot easier for workers to get vaccinated, especially those in the movable middle. So that's a great strategy to employ if you can. State and local health departments are overseeing that process, and every state, again, is different. Most employers, if they don't have the capacity to administer shots themselves, are going to be contracting with a third party. And then there's, of course, the question about whether your company will mandate vaccinations. And what we've learned actually is that a very small percentage, less than 1% of employers right now have chosen that option. And that's because that option has lots of legal issues, mostly around how you're going to deal with exemptions. There are protected reasons for employees not to get vaccines, including religious and health reasons. And so employers will have to make reasonable accommodations for employees that choose not to get vaccinated if they're part of a protected class. The legal issues here are complex. And of course, there are the kind of public relations issues that come with vaccine mandates and the impact on staff morale. So most companies are not right now considering mandates, and that may shift over time, but that's not where most employers are today.
Yeah.
And then finally, I think most companies are asking themselves, will my company continue to wear masks and require distancing and other prevention measures? And the CDC certainly recommends that masking, distancing, and other prevention measures stay in place as immunity builds up. And so, we're really just applauding employers in states that have relaxed restrictions because many employers like Target and Walmart and others, Starbucks, have chosen to maintain masking and distancing inside their locations in states like Texas and Mississippi and Florida that have relaxed restrictions.
Yeah. Well, let's because you've just outlined a couple of really big decisions I think employers have to make. So Aaron, I'm going to call on you to help sort through some of this. I'm not going to go through all of them, but let's start with the administering vaccination in the workplace, because that's become not, a foreign thing for many companies with flu shots. There's a lot in the science right now that with these variants that are concerning the health community about whether we're going to, whether this is going to stick with us for a long time and whether we may have to have boosters down the line, or whether it's an annual shot like the flu because of mutation. So Aaron, let's start with you on this issue, and then I want to move to a few others that Stephen mentioned, but administering vaccines in the workplace. I know it's right now driven by state and state guidelines, but if you look longer term, what are your members telling you about that as an option?
Well, I will say the phone calls that we've gotten have been overwhelming in how can I get the vaccine here, right? I want to get my employees, we're frontline workers. How do I make sure that we've got access to supply? So I think that we will see and we already are seeing, actually, I was just in touch with a manufacturer in Baltimore yesterday who worked with the governor and Safeway and Rite Aid and CVS, and he and other manufacturers in the state are setting up vaccination sites for their employees because they are now in the phase where they are eligible. So I think you are going to see a lot of people stepping up and wanting to offer vaccination locations where they can, to make it as accessible as they can for their employees.
Yeah. And on the issue of in other incentives, extra pay, PTO, Stephen mentioned, we do that in our own company. What are there, when you look at the different incentives, have you started to see patterns in what companies are doing the most of and the least of? You mentioned earlier kind of the gimmicks as something that was a little less, but talk to us about sort of the range of incentives that you're seeing.
Yeah, I mean, well, and I also mentioned, some of those incentives. I mean, I think the key here is that they've got to be broadly available to everyone. And I think this gets to the heart of what is going to get people over that vaccine hesitancy. And this is some of the research that's out there. Stephen alluded to some of it in his presentation, but, you know, positive messaging and feeling like you're doing it for your own reasons versus being told you have to do it is a better approach. And I think, the research that has been done has shown that if you mandate or tell someone they have to do it, that is a big turnoff right away. And so I think what we're hearing and what we've been advising our members, and this has been some of the conversations that I think employers have, we're much better positioned now, but in the beginning, we're like, how do we even talk in a positive way to our manufacturers about this. This is not something that, we normally do on a day-to-day basis, but I think that we've gotten very creative in the positive reinforcement. So, talking about the photo bulletin board where it's voluntary and employees can post pictures of themselves getting the vaccination and feeling like they're a part of a movement. That's really, really important, because that makes people feel like they're doing something to help their coworkers and their organization at large. And if you know anything about manufacturing, and if you've ever been on a manufacturing floor, you know that there is a great amount of pride in the work that they do, and they want to be a part of supporting their colleagues, which gets me to the campaign that we are doing, that is focused on our industry at the NAM, which is This Is Our Shot. And I've got a PSA I'd love to show, and it, really it is designed around, the messaging is all designed around, I'm doing this because I care about my coworker. So let's take a look.
I'm getting the vaccine because I love Frank.
I love you too, man.
Mark?
Eric, tell me, why are you getting the COVID-19 vaccine?
I'm getting the vaccine because I love John's wife. And John.
I'm getting the vaccine because I love the Lancaster High Tigers. #1 fan.
I'm getting the vaccine because I love Margaret.
I love you too.
Oh, stop it.
And cut.
That's great. Aaron, you showed it to me before we went on this, and I was talking about how great I thought that was. We're at Weber Shandwick. We're working with CDC, which is going to release soon their national campaign to address vaccine hesitancy. And what I think those things, and maybe you could talk a little bit about the thinking that went into. You said, by the way, you did that in-house, which I think is terrific because the production value is great. But it hits so many of the hot buttons that we know from the research are so important. That is that the traditional sort of public health messaging of some doctor telling you why it's important you do something just is not working. That it's so much better when it comes from the community, comes from your own workers and friends and family, and has the messaging in there that this is not just important for you, but for the people you care about. So, but I'd love to just hear a little bit more about what went into the messaging of those spots, which are terrific, by the way.
Oh, thank you. Well, we do love those spots and are very proud of them. And, again, it goes back to what I was saying before we went into the video, is that I think for all of us, as we were dealing with how to get people to wear masks and trying to get people to do the right thing, we really were questioning, why is it not working? Why are people not doing what, seems so natural to do? You're helping to prevent someone else from getting sick. And I think that really resonated with us in the sense that, when masks were becoming so politicized, what's a message that's going to take that away? And, we all started talking about, look, one of the reasons we were doing it is I'm not worried about myself getting sick. I'm more worried about infecting someone else that won't be able to manage it or deal with it. And I don't want to be ever in that position. No one wants to be in that position. And so we started to think about messaging in that way. And so, a couple things I just want to quickly mention about This Is Our Shot campaign. Look, there is a lot of great efforts that are going on. And you mentioned your effort, Jack, with the CDC and the Ad Council. And we've been in conversations and are, working with that group, and they're doing amazing, amazing work. Stephen's doing a lot with the COVID Collaborative, which is also doing amazing work that we're working on. We knew for ourselves that these things were going to play at a bigger scale than we were ever going to be able to play. But we knew that back to the stat that you all showed, we could have an impact with our workers. And so we decided it was really important in talking to our members that we lead our own campaign that was geared just towards the manufacturing sector and industry. And so we're doing a couple of things that I think is worth noting. One, obviously, is the PSA. And as I mentioned, we have many companies who are using that PSA in their internal networks to show their employees again, to help incentivize them to think about going out and getting vaccinated. We've also teamed up with the University of Florida, the Center for Public the Center for Public, Interest Communications to do some research message science-based messaging to really look at how can we communicate directly with our manufacturing workers and what are those messages, very, very tailored to our industry. The other thing that we launched last week that I think is really exciting is we've started a ribbon campaign, and we have already had thousands of manufacturers sign up and order ribbons. And what the ribbons do is once you've been vaccinated or a family member in your community has been vaccinated, you can give them that pin, and that shows that they've been vaccinated. So much like, some of the bracelet campaigns we've seen, we think that there's a really positive movement that we can begin within our industry with our workers showing and being proud that they've been vaccinated. So we're super excited about that. And then, we are also launching a rapid response and media digital campaign to really push back and to counter a lot of the misinformation and disinformation that is out there. And we feel, again, we have a credible voice that is going to allow us to push back on some of those messages and put real data and real information out there that is persuading, just like that I Love Frank PSA that we just showed everyone.
Yeah, yeah. I want to channel just for a second, and then we'll switch gears here, but on some of the points, Stephen, that you made, I want to channel my friends in global health on this issue of mandatory vaccinations, because they'll argue, we do it for kids going to school. What do you do with employees that say, I'm really uncomfortable going back to work, back into a work setting where I'm close to my colleagues and not know that they're vaccinated, even if we are wearing masks and socially distanced. So you ticked off a few of the reasons why, and I certainly understand. One of them you said was the PR side of it. Yeah. But talk to us a little bit about what's going through your constituencies' minds as they think about mandatory vaccination.
Yeah, Jack, it's a great question. I think when we started the Health Action Alliance, I think we assumed that more employers would consider this option. The EEOC issued guidance late last year that said that companies could in fact mandate vaccines, and that we expected many companies to follow suit. What I think lawyers started to dig in here a bit and found that it's going to be very complicated for an employer to mandate vaccinations, and for lots of reasons. First of all, there's questions around how you would handle exemptions, which seems to be one of the most critical questions. There are protected classes of individuals, employees, who, for religious, health, and other reasons, will choose not to get vaccinated. And so the question for any employer that's requiring vaccines is, how do you handle exemptions? Who's going to process exemptions? How will you create reasonable accommodations for those workers? Will you allow those workers to work from home? If we go back into an office environment, what measures will you put in place to make sure that those employees that are choosing not to get vaccinated for protected reasons don't feel discriminated against or ostracized in the workplace? There's also just some of the challenges around managing that process, compliance, tracking that companies that will have to weigh as if they do move forward with mandates. And then, of course, there's the impact on morale. And as Aaron stated a moment ago, employees don't generally like to be told what to do, and especially those who are vaccine hesitant. Being told that they must get a vaccine to stay at work is unlikely to land well for them in terms of their own feelings about their employer. The vast majority of employees are likely to want to get vaccinated. And as we believe, as more and more people get vaccinated, confidence will continue to grow. Certainly, the polling that's been done every month by the Kaiser Family Foundation and by other organizations that are really tracking this very closely has seen that the most influential factor here in encouraging confidence is seeing your peers and your family members get vaccinated. And so employers that see the kind of difficulties around mandates, I think, recognize that that as more and more people get vaccinated, it's likely that more and more of their employees will choose to get vaccinated on their own and will be able to reach that level of herd immunity within their workplace that will provide the kind of protection and safety that we'll need to reopen.
Yeah, no, I think you're right. But we'll see how this plays out. I mean, there's also a lot of talk about vaccine passports, whether there's some way other than the little card you get from the CDC, which I saw on the news last night. They're reminding people not to take Facebook selfies and put them on Facebook because you can get your all sorts of information on the card for those who want to take your identity. So don't do that when you get your little CDC card. But there will be presumably, and it was interesting. The Biden administration has said that on this issue they want to leave it to the private sector rather than have a federal. I don't know if you saw that. Andy Slavitt rather talked yesterday about this issue. But many industries may not require it of their employees, but they may require it of their customers. Airlines already have, for example. So I think you're right. It's going to take time as more and more people get vaccinated and we get more confidence and they see that perhaps there are things that they need that they can't go to unless they get vaccinated, that will drive more of this as well. Let's touch on the equity issue that you raised in your opening PowerPoint presentation, because that really is disconcerting. It's something that I know concerns COVID Collaborative and all of us who are working on it. What are there special things that employers can do as well to address that? I open it up to both of you. Maybe Aaron, you'd start first, but I'd like to hear you talk about it because it's such an important issue.
Yeah, I mean, I think, there is a lot to that question that is a work in progress, right? Frankly, I think that, again, it goes back to making sure that you can make it available broadly to everyone and not doing anything that is going to put, one employee over another. And I think this is also, manufacturers, their culture naturally is to really try to take care of all of their employees. And so I think, again, the fact that our phone has been ringing, how do we get access so we can set up our own vaccination sites, is one way that people are really thinking about it, and making sure that they can do what they can to make it available to everyone and not just their employees, but their families. And, manufacturers have such a footprint in communities. I think also the communities that they serve, they care very much about them. And so I think from us, you'll probably hear more on this to come, because it is certainly something that people are talking about and focused on. But I also think it is very much a progress in place right now.
Yeah. Stephen, do you have thoughts on this equity issue?
Yeah, absolutely. Jack, I think for the Health Action Alliance, we believe health equity must be the central consideration as companies build their vaccination plans. And there are a number of steps that companies can take. Many of these are listed in our Quick Start Guide on our website, which is available at healthaction.org. We also have lots of great resources to help understand the unique challenges and concerns of communities of color and other disproportionately impacted populations, and messages and strategies for engaging them. The truth is that the COVID pandemic has disproportionately impacted certain groups. And to turn the tide on COVID-19, we really do need to prioritize outreach and support to these communities. There was good news, as I shared earlier, that vaccine hesitancy is shifting, and these groups, particularly Black Americans, are becoming more and more confident about vaccines. Hispanic Americans, a little bit less so, but confidence is building. at the start, I think any company, as you're beginning to build your plan and develop programming, should start with the communities most impacted within your workforce. And that is likely to be communities of color. And this isn't about trying to convince these groups to get vaccinated. It really is about listening to them and understanding the unique needs or concerns that they have about vaccines, and then developing programming that really helps to meet those concerns and minimize the barriers to vaccination and make it easier for those groups to get vaccinated when it's their turn. Once companies understand the specific concerns and questions, they can also identify messengers that will help speak to these audiences. And I'm very excited to share that the Health Action Alliance is launching next week a comprehensive vaccine education program for employee resource groups and diversity, equity, and inclusion professionals. This program, which is designed around weekly workshops on Zoom that are free for any ERG leader or DEI professional from anyone in the private sector, is able to take this free program. And our commitment, our intention is that those who participate in the program will be able to go back into their companies and really deliver culturally sensitive, culturally competent vaccine education workshops and conversations with their peers and their networks. This program really is intended to speak to the unique needs of these communities and empower leaders of ERGs and diversity professionals with the tools they need to share vaccine information inside their company, and also to champion the needs of these communities to management. And then finally, I would say, it's important that that you constantly be listening and engaging these groups as the vaccine rollout continues. For example, perhaps many of your Hispanic employees live in an area where there isn't easy access to a clinic. What you could ask yourself as an employer, what can you do to help? Could you set up an on-site vaccine clinic? Could you offer transportation to those workers? Could you provide an Uber or a Lyft gift card to those workers to help them get to a vaccine site? Could you provide materials in Spanish? Lots of great questions that you can ask yourselves as you see some gaps in equity in terms of vaccination over the coming weeks and months. But we are so focused on health equity because we know that this pandemic has affected different groups in different ways. And we believe that just by empowering these groups with information, building leadership and capacity to deliver this vaccine education and training at their companies is a great first step. And we would welcome any company on participating on today's webinar to sign up for this program or share it with your peers at your company and your ERGs and your diversity professionals. And you can do that on our website at healthaction.org. And you can just check out the events tab and you'll see more information there.
That's great. Those are great suggestions. We've got a few minutes before I get to the questions that are coming flooding into my screen here, but I just wanted to talk a little bit about the future of the workplace. And since we're giving plugs, our own Pam Jenkins, who runs our public affairs for Weber Shandwick and also all of our COVID actions, yesterday or the day before had a seminar on the future of work. So if you go to our website, you can take a look at that for a little bit more in-depth conversation, which I only can have a couple of minutes to talk about and ask both of you. Maybe Aaron, starting with you, a lot of companies are looking, as we are, at kind of a hybrid model, those companies that have been working remote. And I realize that many of your members have had to, throughout the pandemic, stay on the floor, if you will, in manufacturing. But as you look sort of post-pandemic, what kind of steps are you seeing employers thinking about where they can get folks back into the workplace, but also really assure them of their health and well-being?
Yeah, I will tell you, those conversations are ongoing, right? I think, like all of us, I think the key is reimagining what the future is going to look like and not focusing on going back to what it used to be. And that's really what we've heard from our members, right? We're an industry that already has a hybrid model in place because we have workers who have to be in the facilities and others that don't. And so they have been operating in this hybrid model. And I think, look, there's no question, and this is being talked about from lots of different people. How do you get back the collaborative environment that you need? And manufacturers definitely are. It's a very team environment in terms of the engineering process and the design process to the building and producing phase. And so, how do you ensure that you can still do that in a very safe way? And so I think, for our folks, it is really kind of not focusing on what it used to be, but really kind of imagining what the future is going to look like, and how do we maybe create that.
Yeah, Stephen, the Health Action Alliance, you're doing a lot. Are you also providing some guidance to either members or other companies on how they navigate this hybrid model and return?
Yeah, well, first of all, I will say that we are not the experts in this space. And we've looked really to the CDC, the National Safety Council, and frankly, the National Association of Manufacturers has been doing such great work in helping their members navigate what the new normal is going to be. I think this is actually a moment of great opportunity for employers to reinvent the way we work. And so, personally, I'm excited to see so many of the strategies that companies are considering to reinvent the workplace model. Right now, we are encouraging employers to follow CDC guidance. And the CDC at this point is encouraging employers that have sent most of their workers home to stay the course. It's important, I think, as employers are considering a back to work policy, that they not only follow CDC guidance, but really conduct a thorough assessment of the workplace to identify potential hazards related to COVID-19. Also understand that widespread vaccination of employees can be one consideration for restarting operations and returning to the workplace, but there are lots of other considerations that employers will need to consider, including what are the transmission rates in the community, the ability of your employees to continue practicing social distancing and other prevention measures, what are the state and local mandates around this. There's also news that OSHA will issue an emergency temporary standard that will apply to workplaces, and we expect this to come at some point in the next month or two. And the purpose of this new standard will be to help give teeth to OSHA's enforcement of COVID-19 workplace prevention practices. So this is a space that's shifting rapidly. I think we're going to learn a lot more over the coming weeks and months, and would just, again, really acknowledge NAM as well as the National Safety Council and the CDC that are really leading and providing guidance on these issues.
Yeah, and Jack, on that ETS, I would just say, one of the things that we have been conveying to the government is that in manufacturing, a one size fits all kind of approach is not going to work. And, look, there are jobs where wearing a mask can be very dangerous in our industry. Oh. And so, we have been really working within our industry for best practices, sharing those best practices, and trying to advise the government on how to approach this in a smart way, so we're not in a situation where it's unworkable for people who really, it is more dangerous for them to try to meet the guideline than not.
Yeah. Well, that's maybe a good segue into the first question that I have here, which is a tough question. And that is, under what circumstances can a company require its employees to return to their offices or their place of work? Aaron, with manufacturers, certainly many of them are essential workers. I mean, if you're making ventilators, you've got to keep people on the line. And maybe we'll start, Aaron, with you and then go to Stephen. But how would you answer this question? Are there circumstances when a company needs to require its employees to return to their offices?
Yeah, I'd go back to the beginning days of the pandemic. And again, this is just anecdotally what we heard and saw. People our industry is very proud of the work that they do. And if you have, I mean, I said it earlier, and I really can't emphasize it enough. I mean, there's so much pride on a manufacturing floor in a good time, right? It doesn't really matter. And so I think for us, what we saw was, our manufacturers care about our employees, and they were working very, very hard to make sure that they could keep them safe. And I think, we have been fortunate to be able to hear and be a part of some of those companies that were doing that, and the employees wanted to be there. So I personally am not aware of any company that ever had to say it's mandatory that you come back, right? I think everyone saw that there was a need, whether it was food, whether it was product that people were using to the vaccines and the race, or the ventilators and the PPE. I mean, we had manufacturers, literally, I felt like I was a relief organization in the beginning, calling saying, we can retool our facility to make masks. We can retool our facility to make ventilators. What does the government need? We're on it. What do hospitals need? We're on it. I mean, they wanted, their hands were raised, and they wanted to help. And so I feel very fortunate that we have not really been faced with that question in a big way.
Yeah. Stephen, you have thoughts?
No, I don't think I have too much more to add beyond just acknowledging Aaron and the tremendous leadership of the National Association of Manufacturers on keeping our country moving during this pandemic and providing essential services to so many Americans. And the work that NAM members right now are engaged in producing vaccines is the future, allows us to get out of this pandemic. And so, I think just seconding what Aaron said, we have not heard employers ask us questions about whether or not to mandate back to work. I think most employers are navigating this, and the next few months will really tell how companies will begin to bring workers back into the office. But it's certainly an issue that we'll keep track of going forward too.
Yeah. Here's this. The next question is, how often should companies update their communications and vaccination plans? I guess that's a tough one to answer, but it does raise the point, though, that this pandemic has certainly been a roller coaster, and we're every month or so, it seems like we're in a new kind of phase. Here we came off the winter and the steep slope down, and now all of a sudden we're back into the potential of another surge, which no one wants to call a surge. How do you keep the communications relevant and fresh and on point? Is there any advice that you have on that?
Well, I would just say, I mean, a couple of things on that front. I mean, look, I think, employee culture has, I think, just from what I've observed, really changed, right? Because you are having to communicate differently, and you're having to bring people together differently. And the challenges that workers are facing are different than what they were before. And so, for the people who are at home, it is, how do you turn it off, right? And as managers and as leaders in organizations, we're all having to help our employees manage, whether they have young kids at home, or they're caring for someone, or, whatever, kids home from school. There's so many more dynamics that employees are challenged by and dealing with in this environment, whether they're in a hybrid model or not. And so I think what we've seen a lot of flexibility. We've seen a lot of access to leaders, and where maybe they wouldn't have had that before. Leaders are really trying to be in tune with what is happening with their workers. But the communication, I think, becomes so important, because if you're not bringing people together and reminding them, what your mission and your goal is and what you're trying to accomplish, it's easy to lose that because you're disconnected from that.
Yeah.
And so I think, we have seen again, I think the ability to do the Zoom and those things, I think have been very valuable. And I think, look, you have corporations that are global operations that I've heard people say are more in touch and feel more connected now than they did before because they have this, right? And it's proven that, you don't physically have to always be everywhere to make that connection.
Well, and your point, because so many of these are global organizations, we're all learning to operate in ways that are relevant, but very different in different locations. So because the pandemic is playing out so differently around the world, many of our Asian offices have been back open for quite some time. Stephen, you have thoughts on that? And I got one quick question and we'll have to wrap this up.
Well, in addition to everything that Aaron said, I think for communications professionals inside companies, it's important to plan for uncertainty. And I think your employees acknowledge that and understand by now that this pandemic is a moving target and that things change and that the story evolves. It's important for your team to be really in touch with local health departments and also keep track of CDC guidance. I'd also say that it's important as we kind of continue to this next stage of vaccinations, when all adults will be eligible by May 1st for vaccines, to really listen and lead with empathy, as I know many of your companies already do. But this has been a difficult period for every American. Many of us had experienced COVID. I've had COVID myself, or I've lost family members to COVID, and so really leading with empathy in your communications and acknowledging the challenge and the pain that we've experienced, but also the hope that vaccines and the safety that vaccines provide. So facts, about safety are key, but really emotional triggers are important. And I think, as we celebrate and normalize people getting vaccinated, it's important to stay away from negative language, talk about hesitancy, politics, and if you hear rumors or misinformation spreading within your company, to address those really quickly. And then finally, I would just say expect questions.
Yep.
Yeah, expect questions. This is we're asking folks to make an important health decision, and just knowing that they have a safe space to ask questions within your company, and directing folks back to their doctor or healthcare provider is a great strategy to always plan for.
Yeah, those are great points. And a couple of them may address this last question I had, which we just have a couple of minutes on, because I think you indirectly addressed it. And the question is, how do companies help prevent or manage conflict between employees who have different perspectives on vaccinations? And I think you started, but why don't you continue a little bit on that? Because I think it is something, we find in the research, interestingly, we've been doing research on civility for better part of 10 years.
Yeah.
And you would imagine incivility has gone up considerably. But what's remarkable about the research is the one place that folks find a safe harbor is the workplace, where where that kind of behavior is not as acceptable. And that's also, I think, a relatively new phenomenon. So for us as employers to continue to provide this kind of safe harbor, I think is terribly important. But do you have any tips on this question of how you manage conflict?
Yeah, so we actually have created a conversation guide for managers that was really designed to help managers within any organization have productive conversations about COVID-19 and vaccines with their employees or their teams. We include some guidance there about how to manage tough questions and sensitive issues that might come up. I think really it's important here to underscore that this isn't about trying to convince somebody to do something. This is about listening more than talking, and also just choosing the right messenger. That might not always be your CEO or even your chief medical officer. It might be the leaders of your employee resource groups or other trusted employees within your company. Making sure that those leaders are equipped to have productive conversations and respond to sensitive questions is really important. And so, that's a strategy that we encourage all companies to consider. Yeah. And then finally, really just creating a safe space for employees to provide feedback. And some employees are going to choose not to get vaccinated, and they're your employees too. they making sure that they feel safe inside your company, and there may be many reasons why an employee would choose not to be vaccinated, including health and religious reasons that are protected by law. So they should feel comfortable in the workplace, and you'll need to make sure that they feel safe and supported.
Yeah. Aaron, I'd love to give you the last word on this or anything else you want to leave us with.
Well, I would just say that, it is a really interesting time. And I think, there is a lot of opportunity for employers. I think we are going to reinvent what the workplace looks like. I think it's going to be very different, but I think there's going to be a lot of positive things that come out of this horrible situation that we have all been in. And I will tell you, the CEOs and the leaders of these manufacturing companies that I interact with on a regular basis are very positive and really do believe there's a lot of good to come.
Well, that's a great note to end with. Boy, the hour went fast, didn't it? We could have gone on for quite some time. Thank you to both Stephen and Aaron for taking the time out of your busy days to be with us. I know I speak for everyone here at Weber Shandwick to say that this has really been a terrifically informative discussion. And so to all our viewers, thank you as well for joining this third session of COVID-19, The Path Forward. In the next couple of weeks, we're going to be releasing some podcast episodes that are going to take a deeper dive one-on-one with leading experts around the world. So check out webershandwick.com for more details on that. And until next time, stay safe and stay healthy, everyone. Thanks again, Stephen and Aaron.
Thanks so much. It's been a pleasure.
Thank you.